Okay, here's part 2 of our lecture on obesity. Weakness of the spleen and its inability to manage dampness and leads to the formation of phlegm. This can lead to liver stagnation and depression. Obesity is multi-layered, so it needs a multiple-pronged approach. You'll need diet changes and nutrition changes, lifestyle changes, an increase in activity, and some therapeutic measures, psychotherapeutic measures. Nutritional therapy. Keep a journal of what you're eating, at least a week. Write down what you're eating for breakfast, lunch, and dinner, and show it to me. We might have to see what you're eating. You might not be eating the right things. Usually your favorite foods are not the best for you. Watch what you eat between meals of breakfast, lunch, and dinner. Are you snacking a lot? Are they healthy snacks? Are they junk food? Are they processed foods? And also pay attention on how food makes you feel. Is the food making you feel fatigued? Is it the food making you feel too excited? Does the food make you feel cold, or does the food make you feel hot? Try to eat your breakfast between 7 and 11 a.m. That's the stomach and spleen times. Lunch between 12 and 2. And dinner between 5 and 8. Try not to eat late dinner. Again, try to have 3 meals a day. For breakfast, try something warming like rice congee, millet gruel, steel-cut oats, or an amaranth muesli. Avoid the fruit juices. They have too much sugar and excessive dairy products. So don't have milk and cheese and yogurt all in the same meal. Other items, have a hard-boiled egg every few days, or some light toast and jam, a bagel or steamed bun. Lunch, have a good-sized lunch. But for dinner, have a light dinner. So breakfast and lunch should be the biggest meals that you want to have, and the dinner should be light. Avoid too much dairy. That should be dairy. Small amounts of yogurt, cheese, that's room temperature, not melted like on pizza, and 1 cup of milk. You can also try goat's milk or goat's cheese. Don't eat excessive amount of meats. Some of the Chinese books I've read on diet just say you only need about 15% of meat in your diet anyways. Sweets, irregular food consumption, and skipping meals should be avoided. And do not make dinner the main meal of the day. And don't eat late at night, as mentioned before. Prognosis. If you commit to changes and your health, you can lose up to 15 kilograms in 3 to 6 months. Okay, so when we go to the next section, we're going to be talking about cold, cool, warm, and hot foods. Again, cold foods are like the salads, raw vegetables, a lot of tropical fruits and vegetables. These have a very cold nature to them. Tofu. Again, now no food is bad in Oriental medicine, just there's certain foods that aren't right for you if you want to get better. So, for instance, I like asparagus. So if I have asparagus, maybe I should cook it with some broccoli and green pepper to balance it out so it's not so much cold quality. The cool foods, think of the fruits that grow in North America like pears and apples, strawberries, blueberries, here's cherries, plums, things like that. The warming food, you can have rice with your breakfast, noodle for lunch, some bread for dinner, but don't mix them together. Warming is the cooking style: steamed, simmered, soups, stews, sauteed, stir-fried, things like that. Hot food on the category, this is going to raise your blood pressure. The cold food is going to make you feel fatigued. So the hot foods have a lot of oil in it or greasy, like nuts. Deep fried foods, very oily, greasy. Grilled foods, or anything cooked under direct fire that puts charcoal on the food that when it gets blackened. You want to avoid that. Avocados, just be careful eating too much of that because it has oil in it. Chocolate and cocoa. Coffee. Some people like lamb and duck. Duck's really popular in Chinese restaurants. And spicy, especially red pepper. Now you can have black pepper and white pepper, which are in the warming categories. Okay, so one form of overweight is when you have spleen qi deficiency or spleen yang deficiency. So the symptoms are usually obesity with slack fat tissue. You have few muscles. The patient eats little. They're easily tired and exhausted. There's little thirst. They do desire to drink, and they have sloppy stools. The tongue is usually pale, swollen with the teeth marks. The pulse is faint and weak. The treatments for the acupuncturist would be to needle spleen 3, spleen 2, bladder 20 and bladder 21, which is the spleen and stomach back shoe points, the stomach 36, and the ren 12, which is in the center between the belly button and the sternum. That's the front stomach point. Avoid the ice cold drinks, raw fruits, raw vegetables, dairy, tofu, cold juices, and tropical fruits. Try to have steamed salmon or tuna, beef bouillon or chicken broth, lamb, cherries, plums, apples, fennel, carrots, sweet potato, cabbage, rice, ginger, cardamom, honey, maple syrup, pine nuts, and sesame. Those things are acceptable, are really good. And then there's the overweight type, that's the retention of damp and phlegm. We kind of mentioned this in the last video about phlegm. So phlegm is when damp gets so bad that it causes fire. Think of phlegm as like, I like to think of it, I mean there's several types in Chinese medicine, but I like to think of it as like fat that builds up in the blood vessels, or like cholesterol or plaques. Okay, and the symptoms are hypertension, heaviness in the head, some slowness, pressure in the chest, dizziness, fatigue, and excess weight. The tongue is typically pale. It might have a thick, white, slippery fur. And then the pulse is slippery. The treatment for this is to needle stomach 40, which clears the phlegm, ren 22 in the throat, PC6, calming the mind and heart, spleen 3, which is a wand source point of the spleen, bladder 20-21, the stomach and spleen shoe points of the back, kidney 7, which clears damp, moves water, and bladder 23, that is a back shoe point for the kidney. Avoid dairy, bananas, fatty, oily foods, junk food, sugary foods, raw foods, salads, fruit juices, frozen foods, microwave foods, and alcohol. Try to have more of the cooling foods. You can have bitter, salty. And when I mean salty, try not to use ionized salt. Maybe try some sea salt, some kind of healthy kind of salt. Pears, soy milk, the warming foods, leeks, ginger, garlic, cardamom, and white pepper. There's the obesity type that is stomach fire. This person might have some redness in the face or dry chapped lips a lot. Their symptoms are overweight, but they actually have musculature. They'll have a fat belly, and the patient eats with a lot of gusto. They typically have bad breath, dry stools, constipation, and very thirsty. Their tongue is red, and they might have a thick yellow fur. Their pulse is rapid and forceful. The treatment for that would be the stomach 44, which is the water point of the stomach channel. Again, water to cool the fire. Stomach 45 at the end of the toe. Ren 12, again, that stomach point on the front of the body. PC6, which not only calms the mind, but also has a good effect on the stomach as well. Ren 9, which helps clear damp, and Ren 10, which is below Ren 12, which helps the lower part of the stomach. Again, avoid the spicy foods, the fatty foods, foods that are highly seasoned, hot spices, and high proof alcohol, coffee, red wine, and definitely smoking. Try the cool foods. You can have sour cool foods, sweet cool foods, and bitter cool foods. Some things you can have are like tomatoes, kiwi, celery, water chestnut, mung beans, cabbage, seaweed, green tea, wheat, barley, yogurt, and tofu. Obesity, liver cheese stagnation. Some of the symptoms are feeling fullness, belching, nausea, heartburn, bitter taste in the mouth, upper abdominal cramping. The tongue has a thin white fur or reddish sides. The pulse is wiry or tense. Treatment. Try, we'll do liver 3, the one source point of the liver, LI4. Those two combined, which we mentioned in our acupressure video, is called 4 gates. PC6, Ren 12, liver 14, and stomach 36. Avoid spicy, hot foods, fatty foods, meat, and high proof alcohol. Try to have the neutral and cool foods. We didn't talk about the neutral foods too much, but they're the ones that they don't really change your body temperature. Increase, cook with the steaming and the boiling foods. You can have plums, radish, celery, peppermint tea is really good, and also cook with ginger, garlic, coriander. Kidney yang deficiency. The symptoms are, anytime you see yang deficiency, think that the person, they're prone to feeling cold. The symptoms: accumulation of fat in the abdomen and buttocks, large soft thighs. The patient eats normally, but they have frequent urination, they're feeling cold, they might have sloppy stools, they might have weakness and pain in the lower back and knees. Men might be impotent, and women might have a light or almost no period. Now that's if they're not on like the pill or something. Okay, so some of the birth controls affect the period. So the tongue is pale, and the pulse is faint and deep. The treatment is kidney 7, dew 4, which is very tonifying, bladder 23, tonifying to the kidneys, Ren 4 and Ren 6, both tonifying on the front of the body, and you can use moxa to heat up those pressure points. Avoid cool and cold foods, raw foods, cold fruits, and sugar and alcohol. Try the warming foods. You can have game meat, salmon, lobster, fennel, cabbage, leeks, root vegetables, millet, rice, oats, ginger, garlic, black pepper, cinnamon, chestnuts, sesame seeds, walnuts, and sunflowers. There is some ear acupuncture points we can use. We can try to give you some ear seeds or do ear acupuncture while you're in the clinic. So we would typically do Shinmin, stomach, hunger, the sympathetic, and anti-aggression points. Okay, we'll work on the Qigong in the next video. And this time we're changing it up some to add more abdominal massage. So we'll start with Dantian breathing and do abdominal massage, sit-ups, abdominal massage, leg lifts, abdominal massage, toe touches, abdominal massage, Squats, abdominal massage. Lunges, abdominal massage. Toe raises, abdominal massage. Waist circles and squats, abdominal massage, and so on and so forth. Okay? Alright, so let's, we're also going to close with reverse breathing. So with reverse breathing, you want to inhale, kind of squeeze in, exhale, relax. You can start doing it with the muscles, but then I want you to finally do it to where it's just mentally done internally. Okay? So without using the muscles. Alright, that's it for now, and we're helping you achieve your weightlifting goals.